I'm Dr. Alan Klein. I'm an orthopedic surgeon, and I earned my undergraduate degree in mechanical engineering from Carnegie Mellon. I then went on to medical school at the University of Pittsburgh, and then did my orthopedic surgery residency at the University of Pittsburgh. And I've been privileged to practice orthopedics for the past 25 years here in the Pittsburgh area. I specialize mainly in hip and knee problems. We take care of arthritis, overuse, fractures, and I treat people in the office as well as in the operating room when that's necessary. So what is arthritis? People ask, what is arthritis? Well, arthritis is when the cartilage wears. So the cartilage is the shock absorber on the end of the bone, and it normally protects the bone, but when it wears out, then sometimes you'll have bone-on-bone rubbing, and that can be very painful, especially the more active you are. So normal walking, you have normal stresses across the joint. If you go up or down stairs or you're running, you're putting more and more stress on the joint, and if the cartilage isn't there to protect it, that leads to pain. Arthritis of the hips and knees are common. Generally, it's caused by overuse. Over time, it does run in families. It is seen with people who are obese. An injury years ago can lead to arthritis down the road. We'll treat it with anti-inflammatory medications, over-the-counter medicines, Tylenol, Advil, Aleve. Many of our patients have tried that before they came to us, but that's usually a good start. Sometimes exercises. The right kind of exercises can help improve the symptoms, the wrong kind can aggravate it. So the question is, how do people notice that they have arthritis? And usually it's pain. It starts off with pain with activity. It can lead to pain at rest. You'll often lose motion. The joint may be stiff, especially a knee, it could swell. So when somebody has pain with activities, you think about arthritis if there wasn't an injury. If there's an injury, it's a whole different animal. But typically a patient who has arthritis pain will report an achy pain with activities. The more active they are, the more it tends to hurt. The more they rest, the better it feels. So treatment of arthritis, the most important thing is education. You have to understand your condition. How does it affect you? What can you do to improve it? And what can you avoid to keep it from getting worse? So we first do a thorough evaluation. We make the diagnosis. And it's important for the patient to be involved in this diagnosis and to understand the diagnosis, because that is how we manage the treatment. We manage our treatment based on how much that arthritis affects that patient. So if it's just a little bit of pain, maybe a little medicine will help. But if it's debilitating, you can't walk, you need a walker to get around, well, maybe you'd be a candidate for surgery. And we have a whole gamut of treatments, from over-the-counter analgesics to canes and braces and injections, all the way up to surgery. So we temper our treatment for arthritis based on how it affects that individual patient. So we start off with the most simplest of treatments, over-the-counter pain medicines. Education is important. You have to understand what will help and what will hurt the condition long term. And then we temper the treatment based on how it affects you. So if it just bothers you a little bit, maybe some exercises, maybe a brace. If it bothers you more, maybe an injection of cortisone. We often will suggest weight loss, activity modifications. If it hurts when you do that, well, then don't do it. But if you can't give up what's important to you, well, then we have to temper our treatment based on how it affects you. And it's a collaboration between the patient and the healthcare provider. Not everybody needs an operation. If modifying your activities can allow you to live a happy life, that's perfectly fine. Can arthritis be cured? Unfortunately, there is no cure for arthritis. There's no disease-modifying agent, no injection or pill that reverses arthritis or even slows it down. It's a wear and tear process. If things are terrible and you need surgery, we do joint replacement surgery, which replaces the joint with a metal and plastic joint. And they function well. Most people can do a lot of things. They're not normal. They may not have full motion. They may get an occasional ache here and there, but most patients are very pleased, and it improves their function dramatically. Surgery has risks, and we try to minimize those risks by a very careful selection of those patients to make sure they're in optimal medical shape before you undergo an operation, such as a hip or knee replacement. The most important thing I can say to a patient who thinks they have arthritis is get it looked at. Talk to your primary care physician. Pain without trauma often is due to arthritis, but it could be something else, and it's important to get a good thorough exam and make the diagnosis before you undergo a treatment plan. As an orthopedic surgeon, I have the opportunity and the privilege to help people improve their mobility.